Hi, Dr. Scorah. Thanks for joining me today.
Thanks for having me.
So today we are focusing our conversation, as I said in the intro, on autism. Before we begin, I did give a bio, but I'd love for you to talk about the research that you're doing at your lab and the open science. This is the first time that I get to speak to somebody about how they include this in their lab. So I'd love to hear more about it.
Sure. I'm involved in research projects that really cover a range of different topics. I've been a clinician for most of my career and really have only gotten into research in the last few years. So I'm really more of a co-investigator or a collaborator than sort of having my own research program. And in some studies, I'm not a co-investigator, but I'm the clinician that oversees the evaluation component of the study. So I'm involved in lots of different research projects. And one key area right now is just focusing on looking at the barriers to healthcare for autistic individuals. So this includes a project that's going to run focus groups with different stakeholders, such as clinicians, caregivers, administrators, et cetera, to look at what barriers there are across Canada in accessing and using healthcare services, and to try to identify some solutions to help mitigate those barriers. And another study that we're doing that's sort of related to this idea of barriers to healthcare access is looking at a clinical teaching model that is called ECHO. Mm-hmm. And the ECHO project aims to really, enhance the specialization of clinicians that might not have access to specialized centers or specialized mentorship in an effort to try to increase the capacity of the system generally. So, the goal of that obviously is to try to reduce some of those barriers to healthcare for autistic folks in terms of making, more clinicians able and ready to see these patients and more comfortable seeing these patients in their care. So really looking at those barriers to providing good services is a big focus. And also related to that is another study looking at the caregiver skills training, which is an intervention for caregivers that was developed by the WHO. And hopefully also addresses barriers to healthcare because it is a scalable intervention that doesn't rely on highly specialized therapists. It relies on really parents learning what they can do at home as part of their regular routines to help their children. And then related to open science, certainly most specifically, I'm also a co-investigator on the Quebec 1000 Families Project, which we call the Q1K study. And the project aims to really create a large data repository of information about people across the lifespan who are on the spectrum or have other related neurodevelopmental conditions. And really the idea is to provide just a really huge source of information about many aspects of people's functioning. So from MRI data, EEG data, behavioral data, genetic information, et cetera. And this study was, founded really in the principles of open science. That's a really key part of this study. So, all of the, publications or research outputs would be available on an open access basis. And, in general, the Montreal Neuro has really committed itself to open science. And so this study is very much part of that effort to kind of, make this information really, this research really accessible.
I absolutely love that you guys are focusing on these barriers because I get to see the other end where I'm speaking with the parents and hanging out with them on social media and online in our blog. And I will hear about them and, a parent who receives a diagnosis or is even struggling to get that diagnosis, first of all. And then the question becomes, now what? And how do I access what my child needs or how do I find them? So this is such an important part of the piece of the puzzle for these parents to help them get that access. What do you hear from patients that you work with, in terms of the barriers? What are they struggling with the same thing that I'm hearing from parents as well?
There's barriers at multiple levels. Just accessing a diagnosis is already difficult because there are long wait lists and there's just not enough people that have the specialized training to be able to do that kind of work. And so that's a huge barrier, because obviously, most of these kiddos can't get any kind of supports or services until they have the diagnosis.
Exactly.
And that's kind of like the key to open the door for them. And so there's a barrier right off the bat from just getting the diagnosis. Sometimes that's a process that can take a year or two. And then once they have the diagnosis, because there are limited services and resources and so many people trying to access them, there are long wait lists for all of those services as well. And so, that's another barrier of just waiting for the different services that there might be. And of course, here in Montreal, we're lucky that we have large, treatment centers and more specialized providers. But of course, people across the province who are living in more rural areas and don't have access to a large urban center, those kinds of services that their child needs might not even exist where they live. And certainly, we look also a lot at, how does language, also create a barrier. So there are a lot of families, whose first language is not English or French, or even for Anglophone families, sometimes they can't get services in their native language. And so those are all things that people struggle with, when they're trying to access services for autism, just very similar to what the barriers are for many other conditions as well, really.
Yeah, especially in mental health too. It's just, yeah. The parents on our platform asked quite a few questions actually, and most of them wanted to know what they should be looking for in terms of signs and symptoms, and how early can you diagnose a child. We'll talk about that in just one second, but I'd love to add to that. Like, do you think that we need more, education in terms of helping parents identify this, and this might help bring them to get diagnoses, like a diagnosis, earlier?
I mean, I feel like I've seen a big difference over the course of my career. I'm over 15 years in now, and I feel like there is a big difference in terms of awareness of what the signs and symptoms are. And so I do think there are more parents that are bringing these concerns to their pediatricians or their family doctors than there used to be. Whereas I feel like in the past, these things may have been flagged a little bit more by the doctors or by the schools. So parents seem to be pretty well informed generally, but, obviously there's still gaps. And, it does vary depending on the parent, but I do feel like there's a lot of parents that seem to be more aware of what the developmental expectations are. Certainly, I encourage all parents, if they have any concerns, as early as they have them, as soon as they start having a concern, that they really should talk to their pediatrician or family doctor, because the wait lists are so long for diagnosis that, even though a diagnosis is hard to establish before 18 months, it's still great to get a child on the wait list before that if they can. So, really, so when we're talking about like what age is ideal, really, it's very difficult for us to establish a diagnosis. Definitely before 12 months, we wouldn't necessarily even do an evaluation because we don't have the tools to be able to do that. And, right now, we don't have any biomarkers that can reliably predict autism. So the diagnosis is really based on observing symptoms and behaviors. And the behaviors that we're interested in are things that are related to socialization skills. And these kinds of skills usually, don't come online in infancy, until the age of 12 months or 12 to 18 months is when we start to see some of these social skills that we would expect. And so at that age, you can kind of really start to look at it. So I would say, between 12 and 18 months is about as early as we can really look at this in any kind of reliable way. Nevertheless, it is difficult still to sometimes differentiate autism from other developmental conditions or delays. So usually if we make a diagnosis before 30 months of age, we usually recommend that the child come back after 30 months of age just for another look and to confirm the diagnosis, because it can be really hard to differentiate in that age range. But obviously the earlier the better, because then you can really get the services in place sooner. And in terms of the signs and symptoms to look for, which I think was the other part of the question, from the research on sort of looking at baby siblings of kids who already had a diagnosis. So we, were able to kind of look at kids that we knew were at an elevated likelihood of maybe ending up with a diagnosis. From that research, we know that some of the earlier signs are things like not being responsive to their name or to other vocalizations that the parent is making, of course, in the absence of any hearing impairment, right? So there's no hearing problem, but they're not necessarily paying attention to or responding to when their name is called or when they're spoken to. They also might not be reacting to social smiles. So, when a caregiver smiles at them, they might not be smiling back. And that's something you can see fairly early, actually. And other signs include things like not really engaging in joint attention, meaning that they don't necessarily, attend to things that the caregiver is trying to get them to attend to with them or trying to show them and engage with them. And they also might not be trying to engage themselves or initiating joint attention with the caregiver. So they might be not, trying to get the adult's attention by cooing or making noises as much as you would expect. And other early signs that we see also can include things like not using gestures. So between 12 and 18 months, we expect to see kids pointing and waving bye-bye and, maybe blowing kisses or other little simple gestures like that. But if they're not doing that, that would be a flag, as well as, things like making eye contact when they're doing those things. And we might also see them engaging in some repetitive movements a little more frequently than we would expect, or engaging with objects in ways that are a little bit less typical. So, shaking or spinning things, or, peering at things closely, as opposed to, playing in a way that appears more typical. So those are kind of the things that early on parents can watch for. And certainly, none of those things alone means that a child will have
Yes.
autism. But, if you see some of those things together, it's a good idea to get, to have a conversation with your family doctor and really keep an eye on that and get a referral as early as possible.
Once you mention it to your family doctor, I'm just curious because there are people listening in Canada and the States. I don't know if the systems would be the same, but here in Montreal and Quebec, once you speak to your doctor, who do they refer you to in terms of a diagnosis? Is it a neuropsychologist or psychiatrist, psychologist? Who do you see?
That's a good question. So in Quebec, there are a variety of people that can make a diagnosis. So it could be a psychologist or a neuropsychologist. It could be a developmental pediatrician. It could be a pediatrician. It could be a neurologist. It could be a psychiatrist. So there are various people that might give a diagnosis. But usually, not everybody in that profession would be sort of specialized in being able to do that, right? So they couldn't just go to any developmental pediatrician or any psychologist and be able to have that done. Right. So really what happens here is if there's a concern, usually they're referred to their CUS, their local sort of service center in their region, and that usually gets directed to whatever clinic is related to that sector that could offer that kind of diagnostic evaluation. So there are some clinics within the CU system, and then there's also clinics within the hospitals that aren't part of the CU system. Right. So, the Montreal Children's Hospital and Saint Justin and places like that have specialized clinics to be able to do that. But parents can also go to the private sector if they don't, want to wait for a public health evaluation, and they might be able to get an evaluation a little quicker that way, but then obviously it's not covered.
No, yeah. I'm curious about the prevalence of autism. I've spoken with some older adults that said, well, in my day we never heard of this, and this discussion continues. I'm just curious to know, I know you had a recent study that looked at prevalence and determined that it has increased. Or I'd love to hear a little bit more about that study and what might be contributing to this increase.
Yeah, so we recently published a global prevalence paper that really was the sort of a follow-up to a systematic review that looked at prevalence back in 2012, which I was not involved in. It was done by some of the same members of my team. But certainly since that time, the prevalence rates, did rise. And I mean, I can tell you just anecdotally, over the course of my career, 15 years ago when I started practicing, we were telling families that the rate was about, one in every 150 kids. Whereas now the most recent estimates coming out of the CDC in the US is saying that the rate is about 1 in 44 in the United States. Wow. So that's, quite a big difference over just the last, 20 or so years. So really, the rates have increased. That is for sure, that is certain. And, there's different ideas about what's causing that. Of course, a lot of people think that it's sort of easy to assume that it might be increasing due to environmental factors, right? Like toxins or chemicals that weren't around 100 years ago that might be, making this more prevalent. But really, there isn't much compelling evidence showing a link there in terms of like environmental factors. And we definitely need more research in that area to really kind of figure out if that is a factor. But really, we know that a lot of the prevalence can actually be explained by an increase in the awareness of autism, and just the fact that a lot more pediatricians and family doctors are doing routine screening for autism as part of their well baby checkups at 12, 18, 24 months. So that's become sort of more systematically done over time, which I think is capturing more kids. And there's more concerns also being raised by parents, by daycares, by teachers who are more aware also of what to look for. So that's a big factor. And another factor also has to do with changes in the diagnostic criteria. So the diagnostic criteria have evolved over time. And so now I think more so than in the past, we're recognizing profiles of symptoms that are milder than what we used to really consider to be part of the diagnosis. And we are, identifying kids who have higher cognitive ability and higher language skills that we didn't used to really capture as much. And certainly, we're capturing more girls now than we used to be. So girls were really an underrepresented group, but now we're identifying girls more than we used to in the past. So a lot of these different things have led to an increase in the numbers of kids being identified.
Is autism represented differently in girls versus boys? I've spoken to many women who are adults now that didn't get diagnosed as children, but as adults, and received many different diagnoses as children. So is it because it presents itself very differently?
Yeah, it does, certainly. So we do see in girls that, well, there's actually two sort of patterns. So in some ways, and certainly historically, girls who got diagnosed had more severe symptoms, actually. So there were, among the girls that were getting identified, usually they actually had more, cognitive impairments and more severe symptoms because they were the ones, being identified. Now we're identifying girls with higher cognitive and language ability and milder symptoms that we used to miss. And really, I think it has a lot to do with the fact that girls seem to have milder social impairments and are sort of able to kind of, mask their symptoms a bit better. They're able to kind of look around and imitate their peers a little bit better and really mask their symptoms more so. They also might be a little bit less likely to engage in some of the behaviors that might stick out a little bit more that we see in boys. So they might not engage in as many repetitive movements as the boys do, or they might have sort of these sort of intense interests in girls, the intense interests that we see tend to be in areas that are considered a little bit more socially acceptable, for example, as opposed to some of the intense interests that we see in boys. So it is sort of harder to recognize sometimes. And like you said, quite often we do see that girls will get diagnosed later, in adolescence or in adulthood, because they actually start to really develop more mental health symptoms. So anxiety and depression seem to be what they present with, to a psychiatrist's office or a psychologist's office. And then it's that is sort of the entry point for them. But then through that, sort of process and evaluation, they come to a diagnosis of autism. So it's sort of like a different sort of entry point, because the symptoms do look a little bit different. And, as you said, we often see girls being diagnosed with a variety of things over time that just sort of like don't quite capture all of the, symptoms and aren't quite maybe, hitting the nail on the head, but they often have been diagnosed with other things instead. So there, there's definitely work to be done there, because really a lot of what we know about autism comes from research on boys. And that's who's been in the studies so far. And even our current diagnostic criteria are skewed more towards a presentation that is more sort of common in boys than in girls. So I think there is a lot of work to be done there for sure.
What you described is actually, I spoke with a woman who was in her 30s, and she was diagnosed with autism in her 30s. And you described exactly what she said, where she was diagnosed with at the beginning, I think it was ADHD or ADD. And then it was depression as a teenager and anxiety. And then it was only later that she received her diagnosis. And for her, it was really not eye-opening, but it was not freeing either. Just knowing exactly why she was having these struggles allowed her to work on the struggles, right? So it was really an important diagnosis for her to finally understand why she was experiencing these struggles with work and so on in relationships.
Yeah, I actually often see adolescents and young adults who, when you give them the diagnosis, they actually express feeling really relieved and kind of glad to have that answer, because it helps relieve some of the burden that they felt, of feeling different and not knowing why, and feeling like they weren't, succeeding necessarily socially and not knowing why. And this sort of alleviates some of that burden from them and gives them an explanation, and also gives them a community too, so they can sort of connect with other people with the same diagnosis and kind of see that, oh, there's other people out there like me. So I actually hear that a fair amount.
That's so important. I had another question about prevalence. We'll get back to it, because I really like what you just said. I think I get to speak to some parents who are worried about their child's future, and some parents who perhaps see some signs and are not sure, like are worried about getting the diagnosis, and then what is that going to mean for their child. But the fact that you expressed it this way, and that teenagers or adults are feeling this way, I hope that if there's a parent who's struggling with, going ahead and getting the diagnosis, or that just received a diagnosis for their child, realizes that it's not that there's a light, but there will be a way that they will figure out how they fit within the community and how to use their differences to continue. I don't know if I said it well, but because I don't want to speak on their behalf, but this is what they've shared with me. So I hope this helps them a lot.
I definitely think that, it's important to recognize that anytime you get a diagnosis for your child, there is a process of having to cope with that and deal with that. And parents do report sort of having like a grieving process, and that's normal, and nobody should ever sort of take that away. But I definitely do feel like there is a reason for optimism now more than there used to be, because I do think that there is greater awareness. There's a push for more acceptance, more inclusion. We're seeing more supports, more accommodating environments for kids in schools and their communities. So I feel like there are more efforts now to support these individuals at school, in the workforce. I mean, we still have a long way to go for sure. But I do think that the needle is moving in the right direction. And, with all of the research that we're doing too, we have, more understanding and hopefully can develop, more services and supports that we know can help people succeed. So I think, it's not this sort of gloomy information that maybe people used to think that it was. There was a time when people who received this diagnosis for their child were told that their child would have to go into an institution, for example, and that's not the case anymore. We're doing much better at supporting the differences that autistic people have in the community and at school. So I think there is some cause for optimism there.
Given the research that you've done the past 15 plus years and your work, where do you think we're kind of lagging behind a little bit in society in applying what you've learned in research and applying the science to help autistic people kind of, in their community?
Yeah, I mean, there's still a lot of a lot of areas where we need to do better, certainly. I mean, I think the idea of inclusion needs to move forward a lot more, and not just in the sense of, oh, let's include people because it's the right thing to do, but like, let's include people because these individuals have a lot to offer, and they actually have a lot of really amazing abilities, and are, for example, in the workforce, can be really great employees and really bring a lot to a company. So recognizing that you're including people not just because you feel like this is a charitable thing that you should do. That's certainly not where we want to be. We want to be in a place where autistic folks are being recognized for the fact that they have all kinds of skills and abilities to offer that are really valuable to employers. So I feel like more work needs to be done there to recognize that, and to recognize, to make employers understand, that these people are valuable employees. So there's certainly, work there. And then just generally, I mean, historically, we always sort of said that there was about a 20-year gap between research findings, being actually implemented in clinical practice. So we need to, really try to work hard to eliminate that gap and to, shrink it down so that research findings are being integrated into clinical practice and just, community practices much more quickly. But I do think we're moving in the right direction there. Again, I feel like researchers have gotten a lot better. I mean, the whole open science movement is definitely, I think, really working towards that. And researchers are getting better at leveraging technology and social media to get their research findings out there and more accessible to the public, so people are aware of what is happening in the lab. And I also think that what's nice too is that we're seeing now a lot of funding agencies, like these agencies that give research grants to researchers that are actually making a knowledge translation aspect sort of part of the proposal. So in order to get funded, researchers have to show that they are going to engage in knowledge translation activities to disseminate their work. So those requirements, I think, are all, moving things forward in terms of reducing that gap, for sure.
What is there in terms of the research that that can help somebody who has a child right now who's listening, who's autistic, and says, how can I help my child who's in school right now, function better, I guess?
Yeah. I really think that this is a problem with the research that's been done so far, is that we've been focused so much on identifying what the impairments are. What are these deficits? What are these problems? What are these challenges? And we're not really doing much research to look at strengths nearly enough. I mean, certainly clinically, I've been able to see for years that these folks have all kinds of really cool strengths. And I don't think the research has quite caught up to looking at that yet. I think that's something that, is starting to happen, but really we need to do more of. But what I will say is that there's a study that I've been involved in for a few years now, just as a clinician who's been doing the evaluations on these studies, but a researcher that I work with on her team, Dr. Mayetta Elsabag, she's the principal investigator at the Montreal site of this big longitudinal study called Pathways in ASD, where we've been following over 400 kids since the time they were diagnosed, over 15 years ago at the age of 2 to 4 years, and they're now like 17 to 19 years of age. And this study also is across Canada. So there are sites in Vancouver, Edmonton, Hamilton, Montreal, and Halifax. And so, what's great about this study is that there's very few studies so far that have tracked such a large number of kids for so many years so closely. And the findings from this study are actually, I think interesting because they're showing that some of the developmental course or some of the trajectories of things that we thought might have been true are not actually necessarily true. So, for example, we know that from this research that about 20% of kids on the spectrum had, relatively high adaptive functioning and, have an improving course of symptoms over time, which, I think maybe was more than what people might have previously thought. And it also showed that, having more severe symptoms at the time of diagnosis did not necessarily mean that you would have worse, day-to-day adaptive functioning. And, other things too, like a recent paper by some of my team members who found that kids who have a language regression, so, language regression is something that we see in about 20 to 30% of kids on the spectrum. And I think that there had sort of historically been this thought that kids who have regression, that might signal a worse developmental outcome, but this study has shown that actually when you follow those kids over time, they don't really have worse developmental outcomes than kids who didn't have a regression, and that they tend to follow similar patterns of later language ability as kids without regression and didn't have a really clinically significant deficit in their language skills compared to the kids who didn't have that early regression. So I think there are some things that we're finding from especially the longitudinal research that's showing things that are protective factors or increased resilience, for example. So I think that those are the things that we have to do more work on to look really at resilience and strengths, for sure.
I love that we sort of like flipped it around, like how is society behind and how is research behind? I didn't plan on doing that, but it's nice to see, like, we do need to bridge that gap. We do need to have a lot more communication. I want to make sure that we have enough time to address some of the questions that parents asked, that I asked you. One of them was, so we answered the how early and the symptoms. Somebody asked about DNA testing and if that's available for kids.
Mm-hmm. Yeah, so right now, the general recommendation is that any child who gets diagnosed would undergo what we call a CGH microarray. So it's a genetic test that can screen for different genetic duplications or deletions. So that's a standard test that is available. Unfortunately, the yield from that test is not very high. So we only find some kind of genetic cause in 10 to 20% of kids that undergo that testing, but it is allowing us to find some some genetic causes, and sometimes these kids where we can find a genetic cause, sometimes that also can help with their other with their overall medical care. So sometimes, a child who might have what we call a syndromic form of autism, where there is sort of like an underlying genetic syndrome, which, occurs in about 25% of people on the spectrum. So in those kids, we often do see that they might have other medical issues as well, and other health concerns. And so it can have important implications for their care, because it can help identify, other medical issues that we should maybe be screening for and monitoring for, and to try to make sure that the right things are in place early enough to address those issues. So that is some of the testing that is available. There are also like specific tests that can be done to look for specific genes that we know are related to autism symptoms like Rett syndrome or Fragile X or things like that. So those kinds of tests are available too. But I'm by no means a genetics expert.
That's okay.
But there are more and more things now that they can look at, certainly to help identify, what some of those underlying genetic causes might be.
Got it. Another parent wanted to know what the differences are in the brain between a child who, who's on the spectrum versus one who isn't. Are we finding any differences in research?
Yeah, there are many studies that have found differences, but there's not a lot of consensus on necessarily what those differences are, because there are a lot of different methodologies, right? So you can study the brain using an MRI, an EEG, you can look at autopsies of actual brains, you can look at different types of data, even from all of those different modalities. So there's a lot of different methodologies, and sometimes something that's found in one of those types of studies does not translate to also being seen in another type of study, right? So that's definitely made it a little muddy. There's also differences across the lifespan. So, brains, obviously they develop over time and they change. And so sometimes we might see a difference at a certain age that is not there later on. So if you're studying a sample that includes children and teenagers, or teenagers and adults, it could wash out any findings that might be there, because you're looking at too broad of an age range. So really there are a lot of difficulties in trying to find differences in brains, because it can vary so much between ages, methodologies, and also between different subgroups. So we also know that, autism is very heterogeneous. People have all kinds of different presentations. And, so sometimes people in these studies have been subgrouped into different, types of groups, but those haven't necessarily borne out any real good differences. So what we know really is that it's very muddy. There's not a lot of consistent findings that have been replicated. And it can vary a lot based on the type of study being done. But one thing that generally seems to be accepted as true is that there are likely differences in the connectivity of the brain. So by that, I mean like how the different regions of the brain communicate with each other and are connected with each other. So we don't necessarily, some studies have suggested that there's underconnectivity, others have suggested that there's overconnectivity, and sometimes it depends on the specific network or brain regions you're looking at. So there could be overconnectivity in one area and underconnectivity in another area. So it really does depend quite a lot on what you're specifically looking at. But generally speaking, we know that there are differences in connectivity, but we're not really sure exactly the direction of those differences at this point. So there's a lot of work that still needs to be done in that area to kind of figure out exactly what's going on there.
One parent asked about premature babies, whether or not there's an increased chance of autism.
Yes. So certain complications around birth, like preeclampsia or prematurity, are known to increase the likelihood of getting diagnosed later on. So absolutely, it can be a factor. Obviously, it's not, a one-to-one relationship. There are many kids that are born prematurely who don't develop autism, but it certainly can increase the likelihood for sure.
And this last question from a parent really marked me. And I think we kind of touched on this, but she wanted to know, it was a mom, and asked, that her child has been diagnosed with autism, and is there a hope for the future? I think this touches upon what we were talking about before, and that we need to start including, and not just including for the sake of it, but including realizing that they have so much to offer us. How would you, I don't know, what else can we add maybe to help this parent see that there is a future?
Yeah. So, I mean, I get asked this question a lot when when I've given a diagnosis of autism. Usually that is what the parent wants to know. What is the prognosis? What is the outcome likely to be? And of course, we can never say with any certainty. It depends on so many things. But there are certain things that we do know. So depending on the individual that's in front of me, so there may be certain strengths that their child might have that would indicate a better outcome later on. So for example, having better cognitive ability, having better language skills early on, those things are all known to lead to better outcomes over time. But even in the absence of that, I mean, certainly we also know that early intervention can make a big difference. And, parents being involved in that intervention is also one of the sort of key pieces that seems to really help. So I think, if a parent feels like they're looking for something that they can do, there is a lot that they can do, because we know that parenting, parental involvement in early intervention is something that can, really make a difference. So I like to tell families, of course, I don't want to ever overstate, and if there are very significant challenges, obviously, those things can be difficult to overcome, and some people won't end up living independently and will need supports and services throughout their lifetime, but some people won't. And I think more and more we're recognizing that there are, more and more people on the spectrum who can live independently, can be at school and hold down jobs successfully and have families, so there really is a very wide range of possibility. So that's kind of what I generally tend to tell people, and that really, I think more and more now as a society, there are more services and accommodations to help people succeed to their potential than there used to be.
And I hope it continues as well, because, the more we continue to understand them and understand how we could work with their differences and help them, right? They have strengths, like you said, and we have to do that as a society. I'm thinking of younger kids. The symptoms that parents often talk to me about are the sensory sensitivities or really big meltdowns in terms of emotions. Why do we see such big differences? And also what's interesting is with the sensory sensitivities, we're hearing about it from like the community of parents who have children on the spectrum, but then children who are not on the spectrum also seem to show a lot of sensory sensitivity. Not all the kids, but we hear about it more now. But with regards to autism, why do we see such big differences in these two things?
Yeah. So sensory processing differences are really a key defining feature of autism. It's one of the diagnostic criteria, actually. So it's one of the symptoms that's listed in our diagnostic criteria. It's not present in every case, but it is present in many people on the spectrum. And so really, we don't necessarily have a great understanding of why that is and where those are coming from, but we do feel that the differences in sensory processing are linked to what we were talking before about the brain connectivity, where people might be hypersensitive to certain stimuli, or the flip side might be undersensitive to certain stimuli because of likely how their brain is wired. And so, that can cause sensory overload, right? And there could be things that we're not even perceiving, right? So a neurotypical person might not even perceive a certain stimuli, and a person on the spectrum, for them, it might be overwhelming. And so it can be challenging for, neurotypical parents or, teachers or others to know how to support that, because they might not even be noticing the stimuli that is, so distressing to the autistic individual.
Which could be like a sound or lights, right? I guess just so in case parents have never heard about this, I just wanted to mention some examples.
Yeah, so it can be pretty much any sensory modality, really. But the common ones that we usually, look for and quite often see are sensitivity to noise. So, obviously not the type of noise that all people are sensitive to. I'm not talking about like, fire sirens or things like that, but Regular everyday noises like, a vacuum cleaner or a toilet flushing or, a blender or things like that, so maybe young kids might react to the first time they hear it, but they, learn to tolerate and get used to.
Yeah.
Sometimes, our little kiddos on the spectrum, maybe, just have a really hard time coping with those. So noise is one. Lights can be another one for sure. So, bright light, or certain tactile sensitivities as well. So, some kids really have a hard time wearing certain textures of clothing, or, dealing with tags or seams on their clothing, and, prefer certain textures and won't wear certain textures, or won't wear things that are restrictive around their, neck or their head, or, sometimes they don't like being touched around their head or different parts of their body, or they, have a really hard time touching certain things like, sand or grass, or, things that are sticky, or, things like that. So we see all kinds of those things. And we also see sensory seeking as well. So we see these sensory processing differences, both in terms of them reacting to stimuli, but also seeking out certain stimuli. So sometimes we see kiddos that seem to really seek out certain types of things, like they might visually examine something quite closely because they like the visual stimulation that they're getting, or they might like to feel or touch or lick or smell things that you wouldn't typically expect, kids to want to smell or lick. So we see all kinds of those kinds of sensory processing issues. But the good news is that once you identify what a trigger is, so, once you identify that this particular stimuli is distressing to somebody and maybe causing them to get overwhelmed and have a meltdown, there are, things that you can do about that, right? So, sometimes very simple things like, a child could wear headphones if the noise is too much, right? So some of those things are easy, but generally I recommend that they get an occupational therapy evaluation to look at those sensory processing differences, and to, help create a treatment plan for that, to help them, both find ways of coping, but then also perhaps even find ways of gradually increasing their tolerance.
Got it. Before we end our conversation, I just wanted to go back to prevalence, because I was curious to know why you mentioned boys, and why is it more prevalent in boys? Do we know why?
So first of all, historically, we weren't necessarily capturing girls as much. So we thought that the prevalence rate in boys was, I think, a lot higher than what it actually was. So, a lot of studies find a prevalence of 4 to 1 in boys to girls. So that's the ratio that, we often see. And, more recent studies are sometimes finding a ratio of 3 to 1. So, it is more prevalent. At the same time, I think we're not necessarily picking up on all of the girls. So it'll be interesting to see, how that prevalence changes over time, once I think we get better at identifying girls. But nevertheless, people do still tend to think that there is a true difference in prevalence. And I think that is likely true. And the reason, so a lot of people have sort of posited this idea of what we call the female protective effect, that there's something about being female that biologically kind of protects you from developing autism. So there is, some research to support that idea, that it seems to be more prevalent in boys than girls, because girls often seem to have a higher etiological risk, or a higher genetic loading, let's say, to end up with the diagnosis, as opposed to boys who maybe need, fewer of those kind of risk factors to develop autism.
Thank you. I was curious about that. um, to end off our conversation, if somebody is listening and they have a child who has received a diagnosis and they'd like to participate in research, how can they reach you? Everything you mentioned, by the way, will be in the show notes. So for those of you listening, there'll be links, so it makes it easier for you. But I'd just like to hear it from you before we go.
Yeah, certainly. So, well, there's a few ways. So one way is to visit our website online. So at theneuro.ca/ACAR, ACAR.
Hmm.
So that's a sort of a shortcut to our website that has information about research. Families can also actually just email us directly at autism@mcgill.ca. So
Hmm.
that is the email address where, we have people checking that constantly and responding to parents' queries. And I myself often respond to parents' questions that come in on that email address. So autism@mcgill.ca is a really good way to directly get information from our team. And they can also follow us on Twitter at NeuroACAR, as well as on LinkedIn, on Facebook. So there's a variety of ways
Perfect.
where they can get information.
Thank you for taking the time to chat with me and sharing this important information. I'd love a follow up in a couple years to see like how everything's progressed with the barriers, the studies with the looking at the barriers, and hopefully we'll see changes in less than 20 years in our society.
Yeah,
Thank you. Yeah,
absolutely. I hope so too. Thank you so much for having me. It was my pleasure.
thank you.